everyone to our YouTube channel Forensic Mart. Today we are here with a case study related to forensic science, the substance abuse disorder patient case. Introduction: Medical diagnosis and population substance abuse problem are, according to Volkow and Collins, there is a rapidly developing drug addiction and drug overdose epidemic in the United States. Substance abuse and overdose is an ongoing major issue that contributes to over 90 deaths per day in the American population. Substance abuse or drug addiction is a disease that affects the human brain by causing harmful behavior changes such as increased irritability, hostility, feeling drowsy and sleepy during the daytime, and failing to handle day-to-day responsibilities such as work and or school. The individuals can become addicted to an illegal drug as equally as they can to pharmaceutical or prescribed drugs. The majority of lethal drug complications are related to drug overdose. The drug overdose mortalities include the use of synthetic opiates such as fentanyl and carfentanil. Unlike morphine, byproduct heroin, fentanyl, and carfentanil lead to lethal overdoses much faster than heroin. Fentanyl and carfentanil are added into the street drug heroin, cocaine, and marijuana in order to amplify the effect of other drugs. Fentanyl is 50 times and carfentanil is 5,000 times more potent than heroin. Substance abuse disorder can affect females and males of any race, ethnicity, socio-economic, and financial statuses. The case presentation: a 25-year-old Caucasian male presents to the outpatient detoxification and rehabilitation facility for opiate and alcohol detoxification. For the past 2 weeks, this patient has begun using 15 bags of heroin intravenously, 248 ounce cans of beer, and has inhaled $100 worth of cocaine per day. According to the patient, the main reason for this seeking medical attention is to avoid going to jail. The patient has a history of law violation and has monitored by probation officer once a week. The probation officer worked with the patient and his family to arrange the probation treatment program instead of jail. The patient voluntarily agreed to be evaluated for admission to an outpatient treatment facility. History: Mr. W is a 25-year-old single male who has referred for treatment by his probation officer. Mr. W is currently unemployed and lives with his friend in a different location each day because his relationship with his family deteriorated due to addiction. He is no longer welcome in the family house. According to Mr. W, he is not homeless. I always find a place to crash for a night. Mr. W states that he has been using marijuana from age 15, but it is not his drug of choice any longer. He was introduced to heroin by his best friend about 5 years age during very stressful time in his undergraduate school. He states that his parents and two sisters are aware of his addiction problem and do not support him at all. However, his grandmother understands him more than anyone and support him financially in order to prevent him from stealing. Mr. W states that if you do not admit me today, I will go and get high and I do not care what happened to me after. History of present illness. Mr. W presents for opiate and alcohol detoxification and rehabilitation. He stated that he was found unconscious by his mother in August 2016 and was hospitalized at hospital due to a heroin overdose. He left the hospital against medical advice after 2 days of admission. He denies any history of head injury, trauma, asthma, hypertension, diabetes, mellitus, or seizures. He denies any history of food, drug, or latex allergies. Mr. W also denies any surgical history. Psychiatric history. Mr. W reports that he has struggled with severe anxiety and mild depression from an early adolescence age. He stated that he cannot remember the time when he was free from anxiety without using some kind of drugs. According to the patient, he was never hospitalized for anxiety or depression. However, he stated that he did have suicidal ideation in the past but not suicidal attempts. He denies any history of self-inflicted cuts or injuries. Currently, he is not under either a psychiatrist or psychologist care and does not take any psychiatric medication. Discussion. This case states that the substance abuse disorder is very prevalent among the individuals between the ages of 12 and older, of any gender or socio-economic group. In addition, the literature discusses the different substance abuse preferences among different ages and gender groups. These findings clearly indicate the strong awareness and prevention implication needed at practical level. Conclusion. This case study reports incorporated the review of state and organization reports and peer-reviewed journal articles on the substance abuse disorder among the high-risk age population in order to prevent substance abuse, and the educational interventions need to be effective and consistent among all levels of healthcare providers. In addition, patients, family, in university, college and community leaders need to have available access to substance abuse treatment and prevention materials. Thank you for watching the video. For more such case studies, subscribe our YouTube channel and don't forget to click on the bell icon so that you don't miss our upcoming case studies.